Thank you. Hey, good evening and good morning for some of the US participants. Myself is Naresh, one of the volunteers of IWSP. We got benefited from this program, so we thought of working, supporting them to expand the benefits to every human being in the earth. So we'll start in another few minutes, the actual talk. But before that, a little brief about this particular platform, Integrated Wellness Science and Practice. In short form, it is called IWSP. They have multiple online courses. Going forward, they will also have some physical courses. Right now, they have a lifestyle modification course, which is one of the front runner of this particular 12-session course. They do have another course called physiotherapeutic yoga remedy for all kind of back pain and musculoskeletal disorders. We'll have a little more detail. They do have a daily yoga. A lot of people participates in morning and evenings and they practice together. And they do have a therapeutic yoga programs designed for a specific individual to solve a specific issues. This is just brief about what are all the elements they offer. What is this particular course? Any lifestyle issue, the four pillars, which is diet, activity, sleep, stress management, and habit change. These are all the four pillars. Anything goes wrong in any one or any of these four pillars, that is nothing but a lifestyle disorder. So they cover these four pillars in detail by interventional cardiologist. And then also they do teach 16 asanas, 10 pranayamas, and then guided meditation. This is together is called, a holistic wellness course, they call it as. They have an online platform, myiwsp.com. If you log in to this, you may see this is the website. You may see all these courses listed. You can get to know more details about it, the varieties of courses, what they're offering. As I said, there is a new course they introduced, self-help guide for all musculoskeletal issues like knee pain, joint pain, back pain, wrist pain, especially the people who are all having a sedentary life, like sitting in front of a computer. So a lot of people, they can simply do certain basic self-help exercises which will resolve them. This is again done by another very renowned orthopedic surgeon, and he's a head of orthopedic department at JSS Medical College. So you can see all these things in our website. This is a helpline number. Now come back to today's talk. It is going to be the sudden heart attack is preventable. So this is going to be done by Dr. Susheel K. Sharma. You can look at his qualification. He is a consultant cardiologist, one of the few board certified interventional cardiologists. He's actually an Indian practicing in US. So he practices in Maryland, US. He has about 40 years of experience in handling these cases. Of late, he decided to help people to not get into any of these heart issues. That is what his motto. And then he's dedicating his latter part of his career for this purpose only. Very interesting, very knowledgeable doctor. You will hear from his talk for the next 30 minutes. Any questions you have, put it in the chat box. At the end of the talk, he's available to answer all the questions, whatever you may have it. With this, we'll get into his talk.
Thank you for the introduction. So let me share my screen with you. Okay, so some of you may recognize these luminaries, and just like you, they were professionals and famous in their own fields and achievers. And you know what happened to them. Now, to this list, you can add some more, Saurav Ganguly, our illustrious cricket captain, who ended up having 2 stents. Kapil Dev, my favorite, remember 1983 World Cup? Okay, so he also ended up having a heart attack and ending up having a stent. So what can we learn from what these people suffered? I think that the greatest lesson that we can learn from this is humility. We need to be humble and accept that if people like them, who are affluent, intelligent, illustrious, great achievers like you guys, they had all the resources available to them and they must have used them. And yet they were inflicted with a heart attack. Some survived, some did not, and suffered the consequences. And that's the lesson that I really want to learn. And that's a lesson that I learned from this. It happened to them and can happen to me. So full disclosure, right in the beginning, let me explain to you, and I will detail it out in the talk. My mother had a heart attack. My father had a heart attack. My brother had a heart attack. So it's not a question whether I will or will not have a heart attack. The question is, when will I have a heart attack? I know I will. And therefore, what it teaches us, listening to the tragic stories of these people, is that we should do everything to prevent that heart attack. And here I am with you today, promising you that heart attack is preventable. I am doing that in my own life. Through my personal experience, I know that I had an urgency to act, and I did. And I learned some things. I have been practicing interventional cardiology for the last 40 years. I've done over 10,000 angiograms. I've seen hundreds and thousands of patients with heart attack of different iterations, different types, mild, moderate, severe, fatal, tragic, all kinds of heart attacks. And by taking care of them, learning the science, learning the facts, I have come up with some methodology, which is called Integrated Wellness Science and Practice, and a path, which I call Dash to Wellness, which has certain specific practices that if you practice, you can prevent heart attack. And I follow it, and I want to share with you, and I want to benefit from you. Why? Because I do not want you to suffer a heart attack like these people suffered. Okay, so 50% heart attacks are silent. Now, a lot of you may know this. So what does that mean? What that means is half the time when you and I are having a heart attack, we will not know that we're having a heart attack. So typically, you all know heart attack, you must have seen in some commercials or videos or movies or personal life. You get sudden crushing severe chest pain that hits you in the middle of the chest. You get short of breath, you get diaphoretic, you get dizzy, you get lightheaded. You get this impending failure of dying and doom, and you know exactly what's going on. This is the worst thing you ever experienced in your life. What do? You call 911, you go to the emergency room, you go to hospital, and you know already that you're having a heart attack, and the doctor confirms that. Nice and well. Happens only half the time. Half the time, the heart attack is silent. You don't even know that you're having a heart attack. So before I go to silent, let me put in another 50% figure for you. Half the people that have heart attack actually do not reach the hospital. So you must be wondering, then what do hospitals do? Yes, half of you, 50% that reach the hospitals do a commendable job with angioplasty, stents, bypasses, and intensive care unit and monitoring. And they save 95% of those people that arrive in the hospital with heart attack. So they are doing an excellent job. But that 95% people that survive are from the 50% that reach the hospital. So half the people with heart attack die before they reach the hospital. And half are silent. So time to prevent is now. So what exactly do I mean by silent? Silent heart attack means that either there are no symptoms, or symptoms are so minimal that you ignore them. You may have some chest discomfort, or it could be my indigestion, or they're completely unrecognizable symptoms. They have nothing to do with your chest and heart and all that, but in fact, you're having a heart attack. So we all need to know those symptoms so that we don't ignore them, because if we ignore them, we will not reach the hospital. So instead of pain, you could get pressure, you could get discomfort, or you get heaviness in your chest. If you get that, Please don't ignore it. And you may have no pain in your chest. The pain actually may be in your arm, left traditionally, or maybe right, neck, back, jaw, or a little stomach pain, queasy in the stomach. Typically happens with certain type of heart attack. We call it inferior wall MI. Or you may just get nauseated and you may have cold sweats. You might think, oh, it must be something that I ate last night. I'm feeling a little discomfort, a little uncomfortable in my chest. I'm a little nauseated. I think it's going to go away. Let me take some Tums. Let me take some omeprazole. No, that could be the heart attack. Or you may just have difficulty in breathing. You may feel lightheaded or you may feel dizzy. So see how non-specific these symptoms could be. So if you have risk factors that we will discuss, then none of these factors that I talked here, the symptoms that I talked here, you should ignore because they could all be the symptoms of a silent heart attack. So you go to the emergency room with chest pain, tightness, heaviness, pressure in your chest, you're clutching your chest. That's classic heart attack. Even before you go, you know that you're having a heart attack. Well, the emergency room does an EKG. Some of you sitting in the audience who are doctors can realize this is impending doom. This is a massive anterior wall myocardial infarction. This EKG signifying that the main artery going to the front of the heart, the left anterior descending, is blocked up. The widowmaker, the one that closes and gives you a heart attack and you die. This is an urgency. Immediately he will rush you to the cardiac catheterization lab. Why? Because this is what has happened to the inside of the artery. You see the red portion is the artery, yellow portion is the deposited cholesterol, and the big red blob right in the middle is blood clot. This artery is completely blocked. There is no circulation going through this artery, and your heart muscle is dying. If it does not open up your artery within 90 minutes, you end up with a heart attack. And it does an angiogram. You see the arrows, see how it's pinched there? That's where the blockage is. There's nothing flowing through that. And what he does, he puts a wire and a balloon, opens up, puts a stent, and you see the circulation is restored. And it's dramatic. If you're having a heart attack, you go to the emergency room, doctor puts a wire across and a balloon and a stent and opens up the artery. Right on the table, your pain goes away and you feel different. And this is the procedure that saves your lives, no doubt, when you go to the hospital. But if you don't, then you end up getting a heart attack. Now, see that dark spot there, right, that I've cut through the heart there? That is where the heart attack is, and that is where the blockage is. Now, this becomes a scar tissue. This part is damaged forever, right? But don't worry about it. It's not that end of the story. Ab ji ke kya karenge jab dil hi toot gaya, right? This heart's not broken. Heart has a tremendous capacity to compensate. Other areas of the heart take over. But the important thing then is you don't let it happen again, because if you let it happen again and again, then that heart attacks that pile up then lead to heart failure, and then it gets even more complicated. Okay, so let's see. This is a cut portion of inside of blood vessel that I've taken up from your heart. Just like there's a blood vessel going to your brain, to your legs, to your pancreas, to your liver, to your arms, and to my hands. And each finger has a blood vessel coming. Similarly, there's also a blood vessel going to the heart, because blood vessel is the only conduit through which nutrition flows in the body. So the heart, it's pumping all the time. It's the fastest, strongest, and heaviest working organ of your body. And it needs constant oxygen supply. It needs constant blood. And if you cut open this normal blood vessel, this is what it looks like. And look like that inside, there's a one line, less reddish, more maroonish line, and this is called endothelium. And this is very close to my heart, because this is the lining that is your lifeline. This is the line that keeps the vessels open or closed. And I'll discuss that in detail with you. So first step that happens really is that, see that little rent in the vessel there? That endothelium is broken. And you see a little yellow spot? That's the beginning of the cholesterol. Now you must wonder, when does this happen? Okay, so you remember, some of you may remember that there was a Vietnam War in the 60s that America went through. And there are a lot of young people that went to the war at that time. And the soldiers in their 18, 19, 20, 21, 22-year-old, they died. When they died, they performed post-mortem on everybody, although they died of war injuries, but they needed a post-mortem. But when they cut open their arteries, they found out that those 18, 19, 20-year-old had deposition of this yellowish plaque in their arteries. That was an eye-opener. So the blockage really develops in the second decade, third decade of life, and the heart attack happens in the fourth and the fifth decade. Oh my God. So the problem begins way early in life. If the problem begins early in life, the solution should also begin very early in life. So this one line that is inside, I call it endothelium. This secretes a magic hormone, magic substance called nitric oxide. Now, those of you who may have family members that have heart disease have noticed that they must be taking a tablet called nitroglycerin. Whenever they get chest pain, they roll their tongue up, put a nitroglycerin under the tongue, and the pain goes away immediately. What happens? It supplies nitric oxide. Nitric oxide is a substance that dilates the arteries, opens up the arteries immediately. Now, this endothelium is very responsive to what you put inside the blood vessel. Now, Dr. Robert Vogel, professor of cardiology here in Baltimore, University of Maryland, did a very nice experiment. He found out a way of determining the reactivity of the vessel by non-invasive methods in the brachial artery, and he called it brachial artery reactivity. So what he did is he measured the reactivity, saw how the vasomotor tone is, how the artery is expanding or not expanding, and then made these people eat a double cheese hamburger with French fries. Just one time. 30 minutes later, he found out that the reactivity went down. In other words, the endothelium shrunk, the vessel became smaller. Just one meal can change the vasomotor tone, the tone inside the blood vessel. Now think about it. If you are putting in hamburger day in and day out and day in and day out, and the chicken and the cheese and the butter and the fish and the eggs and all this meat, what is happening to inside of these arteries? How much is it shrinking? How much is the endothelium being damaged? And that is where the beginning happens. So those of you who might think that I am knocking down the meat and non-vegetarian, but the vegetarian is okay. Well, we'll talk about our study in our IWSP study recently published in New England Journal of Medicine, that vegetarian unhealthy diet actually is more harmful than actually a healthy diet with occasional meat. So if you're eating a lot of butter and milk products and cheese, it has same effect on your blood vessels. So that is where it all begins. Okay, and then you keep bathing your blood vessels in cholesterol. Cholesterol comes from fat, high fatty food. And now see how these yellowish plaques are depositing inside the artery, and it's becoming narrower and narrower and narrower and narrower. In addition to this cholesterol, if you are also leading a lifestyle which is full of inflammation that comes from a diet, inflammation that comes from inactivity, inflammation that comes from the stress in your mind, in your life, and the inflammation that comes from your unhealthy habits where you put certain substances such as tobacco smoke or alcohol in your body, which is deleterious to your health, that causes oxidation of this cholesterol. When the cholesterol gets oxidized, it causes inflammation inside the artery. So the cholesterol is depositing inside the artery, and now the inflammation is happening inside the artery. When the inflammation happens inside this artery, it gets monocytes, phagocytes, foam cells, interleukin-1, interleukin-6, all these factors that come in and cause ravage inside the artery. And then what happens? This breaks. When this breaks, it forms a blood clot, and the artery is now blocked. So what happened? It all began with cholesterol, which came from an unhealthy lifestyle. It got complemented by inflammation that came from unhealthy lifestyle. And now the inside of the vessel is what? It's Kurukshetra, right? Okay. All right, so there are some factors that predispose you to heart disease. There's some that you cannot change. So look at the top line. It says the risk factors for heart disease that you cannot change. Age, every time you get a year older, your risk of heart attack gets more. Gender, men in general have more heart attack compared to women, and heart attack comes in men 10 years younger. So a 55-year-old man, if all things being equal, has same risk factor as a 65-year-old woman 10 years earlier. And if there's family history, right? I told you I'm male. My mother, my father, my brother had a heart attack, and I'm getting older every year, right? So these three risk factors I already have. I knew it. I cannot change it, but I don't want a heart attack. Okay. So I checked my blood numbers and I found out I have high cholesterol. I don't have blood pressure, diabetes, and rest of it. So I found out and I said, okay, what is it that I can change? Out of these, mid and the lower limb, only cholesterol belongs to me that I corrected. But if any of these belongs to you, then your risk goes higher. So you should look at it this way. If you have 1 or 2 or 3 of these problems, these 12 risk factors that I'm highlighting here, you're walking towards a heart attack. If you're 4 or 5 or 6, you're jogging towards a heart attack. If you have 7, 8, or 9 of these factors, you're sprinting towards a heart attack. And if you have all 12, you're neither walking, nor jogging, nor sprinting. You're actually sitting. You're sitting on a ticking time bomb. Heart attack will happen. It's only a question when. So you very well know this. Don't worry about writing this down. This will be actually posted on your WhatsApp by Nareshji at the end of the talk. So you will have access to all this. Don't worry about it right now. But just remember, go through this list and see what applies to you. And then determine for yourself, are you walking towards a heart attack? You're jogging towards a heart attack? You're sprinting towards a heart attack? Or you're sitting on a time bomb? When you go to your doctor, make sure that you get these 7 numbers measured and keep a list of that. Now, again, don't try to write this down. All this information will be on WhatsApp for you. What you really need to know is these days, when you get your reports, you see all those arrows. Red arrow pointing up means this thing is high in your blood and it's not good. A green arrow pointing down means it's good and you're fine. So do these numbers and see how many arrows you have in these 7. So if you have 1 or 2 red arrows, right, you're walking towards a heart attack. If you have 3 or 4 of these arrows, you are jogging towards a heart attack. If you have 5 or 6 of these arrows, red pointing up, you are actually sprinting towards a heart attack. And I told you, if you have 7 of these wrong, all red arrows, you're not walking, not jogging, not sitting. You're actually sitting on a ticking time bomb. Okay, so very simple. So the integrated wellness science and practice that we practice and the DASH program that we have, that converts all these 7 up pointing arrows to green down pointing arrows. So if you look at all these from top to bottom and you put my numbers there, you will see green down, green down, green down, green down, green down, green down, green down. But after all this, I still know that I'm walking towards a heart attack. You know why? I told you my family history, I'm male and I'm aging, right? So do what you can change, and what you cannot change, you cannot change. But by just doing this, I know that I can prevent a heart attack, and I have so far prevented heart attack. My brother had a heart attack when he was 43. I'm 65, and still I don't have any symptoms of heart attack. All right, so how does the artery get blocked? I talked about the cholesterol. Cholesterol is a fuel. It is actually what begins the whole process. And cholesterol, you all know, is an animal product. So when I say animal product, please pay very close attention. Eggs, meat, chicken, fish, poultry, they're all animals. Very well, you understand that. One thing that some of you may not understand is the milk, cheese, yogurt, ghee, butter. This also, for the definition of the heart disease, is an animal product. So why do we say animal product? Animal product is the one that supplies you the substance called saturated fat. The saturated fat is what in your liver gets converted to cholesterol. So even when you're eating a diet, extremely healthy, zero cholesterol, right? Zero cholesterol you can go to. But if you're eating saturated fat, right, you're still supplying the liver material to produce the cholesterol. And 20% cholesterol comes from a diet and 80% is manufactured by your liver. Some cholesterol is good. Your body has to produce it. Cholesterol makes the linings of the cell membranes, some hormones, and all those things. So cholesterol is good, but too much is not good. Inflammation happens when you lead certain lifestyle. When your lifestyle is such, your diet is such, your stress in life is such, it creates inflammation, and that adds the fire to the fuel. And what do you get then? You get the blockage. So you got the gist. The cholesterol is a function of lifestyle. Inflammation is a function of lifestyle. Blockage is a consequence of lifestyle. So what do we need to do? We need to change the lifestyle, as simple as that. Okay, how do you lower your cholesterol? You lower your cholesterol by following this integrated wellness, science, and practice, and also doing this DASH program. Now, over the years, I've seen patients that come in and their blockages, and I've been doing, I told you, angiograms and angioplasties for a good part of 40 years of my previous life. And I have seen all kinds of blockages there. We used to put in balloon and we used to put in stents. And prior to that, we had atherectomy. We pulverized them with rotational atherectomy. There's so many different technologies we used. And you know what? My patients used to come and joke and they say, oh, doc, do you not have a Drano? Now, some of you who live in America may know what Drano is. You know how the sinks and the toilets, when they get blocked, there's a very strong chemical that you can drain into that and put like 30, 40 cc's of that syrupy, thick chemical solution and leave it overnight. And in the morning you flush and everything is clean because the chemical in the Drano acts on all the debris that is clogging up the sink or the toilet, and it cleans it up and the flow is restored. That's called Drano. Says, doc, don't you have some kind of a Drano that you can put in these arteries? And every time I'm going through these stents and angioplasties and balloon and clean it up. Now, obviously this is a joke, a lighthearted joke, right? Well, not. Actually, the diet that we recommend in this program provides the phytochemicals. The diet that we recommend in this program provides the antioxidants. Remember, I told you the LDL that gets oxidized is the one that causes the inflammation and the fire in the artery. If somehow you could prevent oxidation of the LDL by removing those reactive oxygen species from your blood, by taking substances through your diet which are antioxidants, you are actually drinking Drano. So a diet which is rich in phytochemicals, and the diet that we recommend is highly rich in phytochemicals. A diet which is rich in antioxidants actually drains and cleans these arteries. And the very evidence came of this in 1990s when Dr. Esselstyn for the first time picked up 35 patients that had the blockages who were going to go for a stent or a bypass surgery and said, you will have none. You will just change your diet. And he put them on this drastic diet, and with diet alone, by performing angiograms before and after, he showed that the blockages in the arteries disappeared. That is how powerful some dietary substances are. That's what is the magic of diet. Now, there is a diet which actually is pro-inflammatory diet. There are substances that you consume in your diet that cause inflammation. You need to stay away from that. There are substances that make the diet anti-inflammatory diet. And I told you 3 of those greatest substances are the phytochemicals, the fiber, and the antioxidants. And that is the diet that we recommend to you. If you maximize that diet, over a period of time, you can clean up these arteries. Obviously, it's not going to happen in a day or so. It takes time. It takes time to change the lifestyle. It takes time to see the benefit, but over a period of time, you restore the health of the endothelium. Just think about what is now going inside that endothelium. It's full of fat and debris. Then that endothelium is shrinking, renting, damaging, depositing cholesterol, adding oxidized cholesterol, increasing the cholesterol plaque, and you're sitting on a time bomb. But if your diet is full of antioxidants and phytochemicals and good fibers, and then you're following other steps that we talk about in this program, then you are moving towards keeping the health of the arteries good. So you lower the cholesterol by following this diet and doing the activities and stress management and habit change that we recommend. It's very important to really understand this, why we have these 4 components. At the bottom is the habit change, but to me, that is the most important, because even if you know, well, right now you could say, I did not know how heart attack happens. I didn't know about risk factors, and here I am. Okay, but now you do. So that excuse is gone. Even after knowing, you'll find out sometimes we end up doing something which we know is not right, but we cannot stop our mind from doing it. And also at other times, we know exactly what is the right thing to do, but we cannot motivate our mind to do what the right thing is to be done. We all go through that all the time. There's this huge procrastination trap. Where does this come from? This comes from 2 components. If the knowledge of the right and the wrong is deeply entrenched in your mind, if that awareness and that discernment is very strong in your mind, and you're very well aware of the consequences of what you're doing, and you follow the scientifically proven methods of habit transformation, you can actually change it. And unless you do that habit change, you understand the science of habit change, it's difficult to change habit. It takes many, many months to change habits. It takes a lifetime to practice a good lifestyle. And it has to be done like that, because the benefits that you want from this should be lifetime. Stress. We discussed with you exactly how stress comes in your life and what it does to your body. We're not talking about how to de-stress you in the gym, or how to de-stress by taking some concoctions, or how to de-stress by watching some movies, and how to de-stress by changing your environment outside. No, we're telling you what stress does to your hypothalamus pituitary axis, what stress does to your sympathetic nervous system, what stress does to your parasympathetic nervous system, and how these 3 combine and coalesce and lead to metabolic syndrome, and how that leads to the lifestyle disorders, high blood pressure, diabetes, cholesterol, heart attack, stroke, chronic kidney disease, certain cancers, and chronic obstructive lung disease. This all percolates from that stress. And how do you prevent that from attacking your body organs and causing metabolic syndrome? That's what we're talking about. We are talking about managing the ravages of the stress on the physiology of your body, so that it does not become a pathology in your body. So we talked about how does the artery get blocked. We talked about cholesterol. What about the inflammation? Now, there clearly is a lifestyle which is pro-inflammatory and a lifestyle which is anti-inflammatory, right? Some things you intuitively know. For example, let me give away one: cigarette smoking, right? You know it causes inflammation in the lungs. It's known to you, right? Alcohol, you know, alcohol causes inflammation in the liver, and that is the cause of fatty liver, right? And fatty liver is the one that leads to diabetes. Now, you might think that, oh, I drink alcohol, I have no problem from it, I drink every day, I'm functional. Well, you're a functional alcoholic. But this alcohol that you're putting in your liver is causing fatty liver. This fatty liver eventually will lead to problems, including insulin resistance. This will lead to diabetes. Inflammation. And that is just 2 examples of inflammation I gave you. Sedentary lifestyle, poor sleep, tremendous stress in your mind, they all cause inflammation. There are dietary components that you eat. You might think very innocuous, very simple, everyday substances, right? that can cause inflammation. Well, we'll discuss in detail in the diet, but I give away some here now. Processed food, saturated fat, sugar, extra salt, all these combined, all these packaged savories, processed food in cans, bottles, packets, instant eating, fast eating foods, they're all pro-inflammatory. And we'll tell you what anti-inflammatory foods are. Okay, so all this then finally leads to atherosclerosis. But as I told you, along with the cholesterol, which is the fuel, inflammation, which is the fire, there are other factors I told you, like diabetes, blood pressure, cigarette smoking, sedentary lifestyle, poor diet, family history. All these things contribute to blockages. So when you do IWSP and you do this Dash to Wellness program, it is not just controlling your cholesterol or preventing a heart attack. It is also reversing your blood pressure. It's reversing your diabetes. It's treating your obesity. It's reducing your weight. It's improving your fatty liver. It's improving your lungs. It's improving your kidneys. And all these also complement towards protecting you from these blockages. Okay, so that is the reason why we recommend IWSP. So when you do IWSP, you will get the knowledge, which will give you the strength to change, just like this butterfly is changing colors here. And that can happen in 3 weeks. In those 12 lectures, you will get ample information to know what to do and what not to do to prevent a heart attack and lifestyle disorder. But we also have a life component to that. Every 2 weeks, people that attend our program then become part of IWSP Life. And that is where you begin your transformational journey. I remember I told you lifestyle transformation takes a lifetime, and it is for the lifetime. So when you transform, then you see how you transform from a pupa to a larva to a beautiful flying butterfly. Now, I also want to humbly submit to you that ours is not the only program that is available out there. There are many other programs. Now, you understood what you need to do to change your lifestyle and benefit. And please do that. Attend a program that gives you scientifically validated methodologies for change and give you practical demonstrations and hold your hand and take you through for the prevention. You do that program and make sure choose a program that gives you at least 3 to 4 weeks of didactic information. It's a lot of information you need. And then every 2 to 3 weeks takes you through that and makes you progress, share with others, connect, learn, experience. Learning and sharing is one most important thing that actually helps you with lifestyle change. So please join our program. If you don't want to join our program, join some other program, but make sure that it fulfills these 2 criteria. It gives you the proper scientific information that you need to change, and then holds your hand and takes you through weeks after weeks on a journey together so that you transform, where you actually connect and improve, where you learn and share. And also, please make sure that you share this information with your friends and family and all those who think can benefit. It helped me, and I want it to help you. I really sincerely want none of you to suffer a heart attack, and I want all of you to enjoy a happy, healthy, wealthy, and worthy life. Thank you. And I'll take some questions now.
Thank you, Dr. Sharma. As usual, another got an informative talk. Karthik, can you make Dr. Sharma pin? Yeah, right. So we have quite a few questions, and also request all the participants, whatever the questions you have, post them in the chat box. We will take one by one. Few questions from my side. That I even though I listened to you multiple times, but still every time when we listen, we get some new questions coming up. So please bear with me on this. Okay. Okay. What is the first aid, or what are the first aid when someone getting these uncomforts at middle of the night in a remote place or something like that, where there is a medical facility is not immediate reach? What should a common layman do at the time?
The most important thing that saves lives is actually aspirin. So if you have not the regular aspirin, but a soluble aspirin, the one that you can actually chew and it gets absorbed from your mouth right away, it's called soluble chewable aspirin. If you take 2 of those aspirin, 75 milligrams, which is 150 milligrams, that is the best first aid that you can do. As soon as you take aspirin, it affects your platelets, it stops the clot from forming, and it buys some time. And the next step, of course, is 911 ambulance, 911, and go to the nearest emergency room. There is no other first aid that you can do at home other than chewing up on 2 soluble aspirins right away.
Right. So in India, it may not be 911. It will be an emergency number, whichever is available.
Whichever is available in your area.
So it's important. I think we all should keep, especially when you have someone a little elderly or someone who is prone to, it's better to keep aspirin in your first aid box, right? And then keep your nearest hospital and ambulance numbers stuck in many places of your home where you can view it. It's all will save life. You talked about the numbers, multiple numbers, cholesterol and multiple things. Then why these personalities did not do this? Because they have all the money, all the health facility available, but still they did not do it, and they ended up, that too, especially someone dying at 38-year-old, that too physically very fit person. Why did this happen? I mean, they have all the money, knowledge in their world available with them, right?
See, the problem, one of the problems with the cholesterol is it's still, a lot of people do not understand how bad is bad. Now, I asked a lot of my patients, no, my cholesterol numbers are okay, but then I do an angiogram and they're blockages. Now, what they mean by okay is 220, 230. For them, it's okay. So really, it's a whole spectrum of cholesterol. Now, 220 may be too high for you. It may not be too high for another person. Remember, because there's so many other factors that come together: cholesterol, blood pressure, diabetes, poor diet, sedentary lifestyle, cigarette smoking, alcohol, obesity, all these factors, family history, advancing age, male gender, they all cumulatively, collectively interact and cause the problem. So that's one answer. The other is that maybe they felt that they're too healthy, they didn't need to check it. That's the other possibility.
Okay. So you usually recommend cholesterol and then 2 other tests. If you do, you can predict your vulnerability in next 5 years, 10 years. Can you just give us one more time? In the interest
So
of
also, along with cholesterol, there is also one more test you should do. Remember, I told you the blockages, there is the fuel, which is the cholesterol, and the fire is the inflammation, right? So cholesterol is a very good thing to check, but you should also check your HSCRP, high sensitivity C-reactive protein. It's actually a marker for inflammation. So if the HSCRP is high, it tells you that there's inflammation going on in your body. And if the HSCRP is high, even a modestly elevated cholesterol may be too high for you. So together with these two, you can get the information. Now, if your cholesterol is modestly elevated, your HSCRP is a little high, then you need to be very aggressive and modify your lifestyle. And if your family history and other risk factors and your risk of heart attack comes calculated greater than 10% in 5 years, then you should also take medications for cholesterol lowering. But if you're reluctant to take that, then there is another test you can do, which is called coronary artery calcium score. It's done with a CT scan. They look at how much deposits of calcium are in the arteries. Calcium is a surrogate for blockages. And if the calcium is depositing in your arteries, that means that you're developing blockages. That means that you must take the cholesterol medication. So the CT scan test is done for those fence sitters, procrastinators, who really should be doing more aggressive treatment but are not doing it. So these three tests together can give you a very good idea.
So all these tests needed only if the cholesterol level is high, right? HS, RP, CT scan, all needed if the cholesterol is high.
Cholesterol is high and you have other risk factors like blood pressure, diabetes, and family history, male gender, advancing age, sedentary lifestyle, cigarette smoking, all those things you have to keep into consideration. Remember, 90% of heart attacks happen in people that have elevated cholesterol, diabetes, high blood pressure, sedentary lifestyle, who do not eat enough fruits and vegetables, who eat too much saturated fat, who are smokers, drink alcohol, and have a stressful life. That explains 90% of heart attack. So if you've taken care of these factors, then you have eliminated 90% of heart attack. Then your risk is only 10%, which is a very small risk.
Got it. Hope that helps everybody. I just posted all those three tests in the chat box. You can make a note of it. Another part you talked about, if you're eating so much of cholesterol, but how do I know as a layman, am I eating more cholesterol or less cholesterol? How do I know? Some people has got a low cholesterol also, right? So how do I know how much cholesterol I'm eating?
So remember in one of the slides, I said that 20% cholesterol comes from the diet. 80% is actually manufactured in a liver. So even if you may be eating a low cholesterol diet, you may still have elevated cholesterol levels. So the important thing is to measure and know how high it is. And if you do these four things that we tell in our program, diet, activity, stress management, habit transformation, with that, you also manage other risk factors that I told you, the blood pressure, the diabetes, the cigarette smoking, stress levels, and all those. So the combined effect of all the things that we're telling in the program is actually to bring you down from the 90% risk down to a 10% or lower risk.
Got it. I think when we are talking about the diet will modify the blockages, I think in some of the South India, especially in Tamil Nadu, there is a medicine called Siddha medicine. There, they call it as food is a medicine.
Absolutely.
Treatment happens through a channelizing right food itself. That I could recollect that.
I've also read some people say that you should really eat food as medicine. And if you don't, then you may end up eating medicine as food.
Correct. Now, another question which came to me separately, not in this, but in a different talk. I'm eating all what my grandparents were eating, but they were healthy. I'm not healthy. Milk, ghee, when we are talking about that part, this topic came. What is your response for that, doctor?
So that's a very good question. You also have to realize what your lifestyle is, what great-grandfather's lifestyle was. Number one, physically, they were far more active. There were no cars, no sedentary lifestyle, no sofas, no chairs. They walked to work. They worked in the field. They did a lot of manual labor. That's number one. Number two is they had tremendous social connectivity, belonging, and those things. They all got together at 7 o'clock in the evening and they did some kirtan, bhajan, satsang, spiritual talk. So their level of stress was much lower. And the stress in our lives, the dietary expediency that has come, the fast foods, we're consuming more nutrients than we need, and we're consuming wrong nutrients. And the third thing is the stress is much greater in our lives compared to their lives. And therefore, now it's not appropriate to eat the diet that they ate. So if you can bring your stress level down to the same level that grandpa had, if you increase your physical activity to the level that your grandpa had the physical activity, and also you need a happy, connected, belonging, satisfying life, which is without any grief or stress or problems, then yes, then you can also eat that diet. But the fact of life is that we are leading a very fast life. We have very little time to do physical activity. We all have multiple stresses in our lives, and our food has become now different. The fast food, the processed food, the ingredients, the chemicals that go in our food, and then the organic versus non-organic, and then the environmental pollutants that are going in our body. Things have changed a lot. So we really cannot eat the same diet.
Got it. I think you already covered this question, but still, what are the three takeaways from this talk for listeners, doctor?
So the number one takeaway is that you must get your 7 numbers checked. Number two is the second slide that we're putting in there, the risk factors. You should see how many of those belong to you. And number three is if you have multiple of those factors and you have numbers that are not right, you need to have a consultation with a cardiologist to see what can you do to optimize your risk. Now, number one thing to optimize risk really is the lifestyle transformation. And lifestyle transformation is what exactly we do in our program. So even if the numbers right now look okay, they might change in 2 years or 3 years. But if you change your lifestyle, then you've taken care of this for the rest of your life.
Yeah. Thank you, doctor. Many of you, a few more questions, we'll take it and then come to that part. Is this bad HDL little higher than 90 and LDL 110?
Yeah, so this is a very individual situation. I know this person again also put in that HSCRP is 0.25. So you really need to have an individual consultation. But broadly speaking, HDL is protective. But now there's some data coming out that the HDL actually has a U-shaped curve. So as it goes higher, it's good, but sometimes too high also is not good. And LDL 110 is not good if you have other risk factors, although your HSCRP is low. So basically, these are all tests that lead you to a situation where you need to have an individualized consultation and get an individualized prescription. But again, irrespective of the test, lifestyle transformation is still the key, and attending the IWSP and going through DASH program is the answer to optimize all these numbers.
So we will take a few more questions. In the meanwhile, Lata has raised her hand. You want to unmute and ask any question directly, Lata ma'am? Please go ahead. She's unmuted. You can talk straight away. Please go ahead. You may talk, ma'am. You may ask your question. I think it was an accidental hand raise. Okay, I'll come to the next question. Doctor, though focusing on health is a priority for everyone, but people generally do not prioritize it. It is always a last choice among the priority list. What are the probable reasons of this mindset, and how could we begin to change this? This is an excellent question.
We all have our priorities in life, and we all have a list of priorities that changes in life. At different stages of life, there are different priorities. And whether you believe it or not, the closer you come to the impending doom, the more your priorities change. So when you are 20 or 30 years old and you understand that if you do not follow this lifestyle, when you're 40 or 50 or 60 years of age, you may get a heart attack. What you do is there's a term for that called delayed discounting. So what you say is, okay, it's going to happen 30 years from now. Why should I deny myself all the smoking and the drinking and the wrong type of living right now? Because I enjoy it. So you discount what is going to happen at a delayed time, right? And the antidote to delayed discounting in behavioral modification these days is called episodic futuristic thinking. So what you do is you really have to sit down and say, okay, now I'm 50 years old. I have a heart attack. I do not have saved enough for my retirement. My children are going through college. I have a wife to take care of, parents to take care of. What if I die at 50 now? And what happens to my loved ones? That is, although you're only 20, but you're bringing forward that what is going to happen in 50 years age. That's called episodic futuristic thinking. So delayed discounting, delaying whatever is going to happen in future, you discount that. That is what makes you procrastinate. But episodic futuristic thinking is what makes you realize that I must take care of this right now. So depending upon where your mindset is at a given time, between the two interacting in your mind, that is what determines your behavior.
Yeah. Yeah, it's a very common problem. When we, even with this heart, if you take somebody in a very close circle, somebody, passed away due to heart attack, the next 10 days, we'll be looking for all this information and slowly we leave it and go back to we forget it. And this is happening. Very often it is happening because we are at the stage where our near and dear, we hear it, that they are passing away because of this, but still we don't.
And I tell you, 4 years ago, one of my best friends, I say that in my talks, passed away from heart attack in the middle of seeing patients in his office, a cardiologist. And that was an eye-opener for me. So there's things that I was doing, but not as aggressively as I needed to. And that changed 4 years ago for me. And that is where finally I came up with all this program also, because I changed my lifestyle drastically. I follow everything that I say on the program to the dot. So again, when something up close and personal happens and tragedy happens, we all change. And that's just human nature.
I think we should think about it. We should not wait for something happen to us. We should learn from what is happening around and we should prevent it. Okay. Under what condition and when a CRP need to be performed?
Okay, so if your cholesterol is elevated, right, you need to do something about it. But if you decide not to do it, that's an additional tool that you can do. And if CRP comes elevated, it tells you that in addition to cholesterol, you're now also having inflammation in your body. Now you have two problems. So that will actually motivate you to do something about the cholesterol, which is lifestyle transformation. And depending upon your other risk factors, whether you do or should not take statins to lower your cholesterol.
I misspelled it, doctor. You still answered one question. It's a CPR. Under what condition and when CPR to be performed?
Okay, so if this is a CPR, so CRP and CPR are two totally different things.
Correct.
CRP is a high sensitivity protein that we talked about for inflammation. But CPR is cardiopulmonary resuscitation. If that's what we're talking about, you do CPR when there's a sudden cardiac death. When somebody gets a heart attack and dies in front of you, you start CPR. And CPR here stands for cardiopulmonary resuscitation.
Correct. I think that we should be trained to do this, and there is a lot of good material available. I think all of us should know how to do a basic CPR, will save lives. Another good question. What is the difference between cholesterol and fat?
Okay, so that's a very good question, because that one difference is also exploited by the industry, right? So they will say, this is cholesterol free. This is fat free. Now, cholesterol is a type of fat. And you also know that cholesterol is only found in animal products. But a high fatty diet, if you have a high fatty diet, fat and cholesterol usually go together. So even if you're not consuming cholesterol, for example, the egg industry uses this a lot of times. They say, okay, there's a lot of cholesterol in the yolk. You don't eat the yolk and you eat the white part of the cholesterol, right? The egg. Now you're not getting cholesterol, much less cholesterol, but you're still getting fat. So as I told you, 20% of cholesterol comes from diet and the 80% of cholesterol is manufactured in the liver. So where does the liver manufacture that cholesterol from? From the fat. So if you take too much of saturated fat, eventually it is going to end up as cholesterol.
Okay. Too much of gastric acidic also at risk is a question. Too much of gastric and acidic is also a risk.
No, there is no correlation between acidity and gastric issues and heart attack. But sometimes, and it's unfortunate, and I tell this story of a friend of mine who's a cardiologist who had acid indigestion, and he was vacationing in Sri Lanka at the time, and he started getting indigestion again. His wife told, look, you must get checked out. He said, no, it's the same indigestion. He kept taking the Zantac, the Prilosec, all those things. Anyway, he came back to America. It continued, and it turned out when he had the angiogram, he had severe blockages and was on the verge of getting a heart attack. But he kept thinking, oh, it's just the same indigestion. So sometimes it's very tricky. The indigestion and the cardiac symptoms can be very similar, and one or the other can be confused for one or the other. So it's a very tricky situation.
Okay. So another question is very specific, individualistic question that we should take it on one-on-one. Another one is, when a person complains of chest pain, is sitting or sleeping posture better till they reaches the hospital? Which posture we should maintain?
Well, the most comfortable posture obviously is lying down, propped up a little bit until the help arrives. And as I said, taking 2 soluble aspirins.
Please, can Team IWSP share this recording on the WhatsApp group? Yes, we will share. In fact, we will share the 2 slides, whatever Dr. talked us to, share it with, as well as the recording of this video to your email ID, because not all of them will be in one particular WhatsApp group. So we will send it across to all your email IDs. Please share it with all your known people. That is important. We are not telling you should join this particular program, but be conscious, understand that this is a risk. Join any program, do some modifications so that change the lifestyle. This is what we are looking at it. With this, is there anybody has got any question? You want to unmute yourself and ask direct question also? We have 1 minute time to go for it, please. If anyone wants to. Okay, so I think we are done, and the team has put the link in case if you want to join the program, what is to be done, and also the helpline number they have put it. They will also connect with you through email also. So with this, thank you so much, Dr. Sharma, for again giving us information. To all, thank you so much for a patient listening, and hope that this was helpful to all of you, and please share it with all your near and dear one. With this, we'll close for the day. Have a good night and good day. Thank you. Bye.